Hello, I'm Dr. Dan Doleys, director of the Doleys Clinic, and I want to talk to you a little bit about spinal cord stimulation. So what is spinal cord stimulation? It is one of the therapies that is called neuromodulation, and neuromodulation contains two therapies. One is spinal cord stimulation. The other involves the implantation of a pump that can be connected to a catheter that then infuses medicine into the spine. How does spinal cord stimulation work? There are two suspected mechanisms at least. One is what's called a conduction block, and that is where the electricity that is administered in very small amounts to the spinal cord tends to block the activity of pain coming up to the brain. In some cases, it is also suspected that this electrical impulse may alter the way the brain reacts to signals once they arrive, so there are at least two mechanisms. Many people ask, is spinal cord stimulation like a TENS unit? TENS units are used superficially on the skin, and they may help some of the impulses from getting from the skin into the cord. But comparing spinal cord stimulation to a TENS unit would be like trying to compare X-ray to an MRI machine. Spinal cord stimulation technology is much more sophisticated than is the TENS unit, and it is applied in a very different location, and oftentimes the results are very superior to the TENS unit. However, it has been shown in some cases that a positive response to a TENS unit might be a good predictor for an outcome with a spinal cord stimulation. On the other hand, those people who find stimulation with a TENS unit very uncomfortable may not do well with a spinal cord stimulator. Can spinal cord stimulation be used with all types of pain? When it initially came on the market, spinal cord stimulation was designed to address neuropathic or nerve-related pain, shooting, stinging, burning pain, oftentimes into the leg. However, with advancing technology and more research, the indications have broadened dramatically. So at this point, it can be used for spine pain, back pain, hip pain, and there are many other indications, and those indications continue to grow. There are things that the spinal cord stimulator will not significantly modify. For example, if you have what is called mechanical pain, that is, you move in a certain position and you get this sharp shooting pain in your back or down your leg, the spinal cord stimulator is not likely to suppress that. It may minimize the pain and help you to get over it, but that mechanical compression is not something that spinal cord stimulation will necessarily resolve. Likewise, if you are one of those people who have weather-sensitive pain, where fronts come in and then you have more pain because of barometric changes, cold weather, rainy weather, the stimulator is not likely to eliminate that, but it can help it. Also, for those of you who find that under conditions of extreme stress, your pain is much worse, the stimulator is not likely to eliminate that, but it can help. What are the complications or side effects of spinal cord stimulation? Spinal cord stimulation does require a surgeon, an anesthesiologist with surgical experience to implant the device. So as with all situations, surgery does carry with it a certain risk for infection, but the surgery that's involved in spinal cord stimulation oftentimes is not as extensive as one might undergo if they were having a spinal fusion. One can also have what is called positional sensitivity. And what that means is the electrode, which is located close to the spine, when you move, may move further from the spine, and you will lose the electrical impulse blocking the pain. In another situation, it may move closer to the spine and stimulate it, and so you would have this change in the pattern depending upon how you move. Now, for the most part, oftentimes once it is in, it will adhere and it will move along with the spine, but sometimes you can have that spinal or that positional sensitivity. Most of the current devices, and the technology has expanded, most of the devices are MRI compatible. In the past, the devices, if you had a stimulator in, you could not undergo an MRI because it might produce damage to the device or to the spine. Are there different types of spinal cord stimulators? Right now, there are at least 4 different companies that make stimulators, and they all have their own unique features. Some stimulators are reprogrammable, others not. Some are rechargeable, others not. The battery life varies as well. So it is important that if you are considering this, that when you talk to your implanter or spinal cord specialist, that you find out which device they are likely to be using. There are rechargeable, non-rechargeable batteries. The difference is that with a rechargeable battery, oftentimes the battery will last longer than a non-rechargeable. But there is then the extra effort of having to recharge that battery. Most of the time with a spinal cord stimulator, folks will use an electrode that looks something like this, and it has various contact points on it. Depending upon the device and the implanter, they may use one or more electrodes. Ordinarily, it can be put in on a temporary basis, so one of the nice features of a spinal cord stimulator is you have the opportunity to trial it before it's actually implanted. Usually the trials are 3 to 7 days, and this gives you the opportunity to see whether or not it actually may help you. Now, from my perspective, an important thing in the trial is to not only pay attention to whether or not it helps your pain, but does it help you to do more? So we encourage our patients to identify 3 functional goals that they hope that they might be able to achieve if this helps their pain. For example, standing longer, going to church, going out to dinner and sitting, going to grandchildren's ball games. So it's important during the trial to test it out and see if it actually helps you to function better. In some cases, this will be used for the trial, but then a neurosurgeon will come back and put in what is called a paddle lead. Now, this requires a laminotomy, and it is stitched into place, so the likelihood of it moving or having positional sensitivity is much less. So you want to be sure when you're talking to your implanter to find out whether or not they are going to use what's called a percutaneous lead throughout, or whether they will trial with this lead and then go ahead and have a surgical lead permanently implanted. Batteries are of various size. This is not an atypical size for the battery, and they're different depending upon whether or not they are rechargeable or non-rechargeable. What about the success rate? It's a bit hard to give an accurate estimate at this point because some of the new technologies have only been out a few years and there's not been the opportunity to do long-term studies. However, the long-term studies that are available do suggest that people who pass the trial and report that they've had a good outcome, on average, report 50 to 60% improvement in their pain. Now, the data on improvement in functioning isn't as clear because sometimes those data are not collected during the studies. So it would be, in my opinion, unrealistic to anticipate or assume 100% or even 90% relief of your pain. And keep in mind that the spinal cord stimulator does not correct anything. It does not fix abnormal pathology. Its goal is to help to suppress and overcome the pain signals so that you have less pain and can move around better. Some of the new technology are reporting relief up to 80%, but again, the long-term studies have yet to be done. Why is a psychological evaluation required for someone who is considered a candidate for spinal cord stimulation? There are at least 2 reasons. Number one, it is known that there are some individuals that are not going to be good responders to a spinal cord stimulator. There may be people who have difficulties with addiction, profound depression, may be suicidal. There may be other individuals who have rather severe psychiatric problems, and having something implanted, not only will it not help them, but it may indeed aggravate their underlying condition. The second reason is that we know that there are a number of factors that can affect pain. Anxiety, depression, stress, things of that nature. So it is important that prior to having a stimulator implanted, the implanter and the patient are aware, if they have these risk factors, if you will, that they do exist. And it's important that they receive some education on how to modify these risk factors so as to have the best possible long-term outcome. This is not an inexpensive procedure, so anything and everything that we can do to help the implanter and the patient have a good long-term outcome is an important part of the process. So there is no attempt here to tell somebody that somehow or another they are psychologically unfit, unsuited. It's more a matter of getting the information to help the patient, and this is not uncommon when undergoing any type of surgery where you hope to help the pain. The question sometimes comes up if there are any contraindications for individuals who have what we call cognitive disorder. Cognitive disorders could come from people who have had concussions, traumatic brain injury, dementia, Alzheimer's. There is a relative contraindication for people who have a difficult time comprehending the technology, the positioning of the electrode, and especially what might need to be undertaken to recharge the battery. Now, sometimes if they're in a situation where they have family members that are there to attend and help, this can be overcome, but it is an important consideration in properly selecting the right patient for spinal cord stimulation therapy. For those of you who are viewing this in the immediate Birmingham or Alabama area, we've been involved in working with these devices since 1986. We're very glad to entertain any questions for you to contact the clinic about an appointment to sit down and review the technology and the process. If this is an interest of yours, I find it very beneficial to talk to not only the patient, but a family member, spouse, or support persons. Oftentimes, family members are a big part of this process, and I find it important that they understand the technology and what their role can be in helping the patient get the best results. If you are living outside the immediate area, you should feel free to go on the computer, look up the various technologies. You might be able to contact a representative locally, or you can get information on local pain management physicians, usually anesthesiologists, and you can find information on those who are involved in neuromodulation. You, of course, want someone who is experienced and who has a background in this therapy, and you should not hesitate when you contact them to communicate with them to ask them what their experience and background is and what their relative success rate has been. So I hope this has been beneficial and helpful, and again, do not hesitate to contact us with any comments or questions or setting up an appointment if you wish to sit down and chat about this technology. Thank you.